My name is Pam Johnson Gross, and the title of my presentation is Why Does France Have One of the Best Healthcare Systems in the World? A country's healthcare system is one of the biggest contributing factors to the well-being of its people. It impacts a country's financial situation, not to mention the general health of a country's people. We know that the United States is one of the most developed and powerful countries in the world. Maybe surprisingly, its healthcare system simply does not hold up when compared with other countries. Looking at the most current rankings from the World Health Organization, France is ranked number 1, while the United States is ranked 37. Surely there is something to be learned from the healthcare systems on this list. According to the World Health Organization, there are many failings of the healthcare system, including many health ministries focus on the public sector and often disregard the frequent much larger private sector healthcare. In many countries, some, if not most, physicians work simultaneously for the public sector and in private practice. This means the public sector ends up subsidizing unofficial private practice. Many governments fail to prevent a black market in health, where widespread corruption, bribery, moonlighting, and other illegal practices flourish. The black markets, which themselves are caused by malfunctioning health systems and low income of health workers, further undermine those systems. Many health ministries also fail to enforce regulations that they themselves have created or are supposed to implement in the public interest. The United States per capita healthcare spending is more than twice the average of other developed countries. Per capita is also known as income per person. It is the mean income of people in an economic unit such as a country or city. It is calculated by taking a measure of all sources of income in the aggregate, such as gross national product income, and dividing it by the total population. Although the United States is ranked at 37 as one of the best healthcare systems in the world, it is spending more money on healthcare than any other country in the world. As we look at these developed countries, let's compare the United States and France. France spends $4,530, while the United States spends $9,507. Now we will look at the French healthcare system. Who's covered under this system? Coverage is universal. All residents are entitled to coverage from non-competing statutory health insurance SHI funds, which are statutory occupation-based entities. Entitlement comes through employment for salary or self-employed persons and their families. As a benefit for people and their families who have become unemployed, and through a student or retired person. Since the introduction of universal medical coverage in 2000, the state has covered the healthcare costs of residents not eligible for SHI, 0.4% of the population. The state covers illegal residents who have applied for residency. Visitors from within the EU are covered, but non-EU visitors are covered for emergency care only. Complementary private health insurance covering users and or excluding services, for example, psychologists and dietitians, covers 95% of the population and is obtained through employers or means-tested vouchers. So how is the healthcare funded in France? The provision of healthcare in France is a national responsibility. The Ministry of Social Affairs, Health and Women's Rights is responsible for defining national strategy. Planning and regulation of healthcare involve negotiations, which are translated into laws by Parliament. The healthcare system in France is funded partially by obligatory Social Security contributions, which are usually deducted from an employee's salary. In 2016, employees paid around 8% in total, while employers paid around 13% of salary towards health costs. The French healthcare system is also partially funded by the government, and the patient too pays a small contribution to their healthcare costs. Now we'll take a look at how the French healthcare system is organized. In France, when you see a doctor or have medical treatment, a percentage of the cost, Usually about 70% of doctors' fees and 80% of hospital costs will be reimbursed for most people through the French healthcare system. So as long as you are referred by your attending doctor. In the case of some major or long-term illnesses, 100% of the costs are covered. The remainder of the charges must be paid for either by the patient or through any supplementary private insurance. Coinsurance rates are as follows, depending on the type of care. Inpatient is 20%, doctor's visits are 30%, and dental is 30%. This slide shows the organization of the healthcare system in France and is broken down by the two levels, which is the national level, which includes parliament, the government ministry, the national health, and broken down into the different entities. Then there is the regional health, which shows the more of the medical side of it, the Regency Healthcare Agency, and the different services that are provided. So what does France's healthcare cover? France's healthcare system allows a number of free preventative medical examinations which are tailored to each person according to age, gender, work, and social risk factors and environment. The list of procedures, drugs, medical devices are covered under SHI and defined at a national level and apply to all regions of the country. Included are hospital care, treatment in public or private rehabilitation, outpatient care by general practitioners, specialists, dentists, and midwives, and there are some preventative services. Now we will take a look at the United States healthcare system. Who's covered under this system? The United States health system does not provide health to the nation's entire population. The Affordable Care Act established shared responsibility between the government, employers, and individuals for ensuring that all Americans have access to quality health insurance. Individuals acquire health insurance to offset healthcare spending. In 2015, about 67.2% of U.S. residents received health coverage through private voluntary health insurance, VHI. 55.7% receive employee-provided insurance, and 14.6% acquired coverage directly. Public programs covered roughly 37.1% of the residents. Medicare covered 16.3%, Medicaid 19.6%, direct purchase 16.3%, and military coverage 4.7%. In the first quarter of 2016, 27.3 million individuals were uninsured, representing 8.6% of the population, down from 9.1% in 2015. Undocumented immigrants are generally ineligible for public coverage, and nearly 2/3 are uninsured. The United States health system is organized into public and private health care. We will now look at the publicly financed healthcare section first. In 2014, public spending accounted for about 49% of total healthcare spending. Medicare is financed through a combination of payroll taxes, premiums, and federal general revenues. Medicaid is tax-funded and administered by the states, which operate the program, within broad federal guidelines. States receive matching funds from the federal government for Medicaid at rates that varied based on their per capita income. In fiscal year 2016, federal matching ranged from 50% to 74% of states' Medicaid expenditures. Now we'll take a look at the privately financed healthcare. In 2014, private health insurance spending accounted for about 39% of total healthcare spending. Private insurers, which can be for-profit or non-profit, are answerable to state insurance commissioners and subject to varying state and federal regulations. Private health insurance can be purchased by individuals, but is usually funded by voluntary tax-exempt premiums, the cost of which is shared by employers and workers on an employer-specific basis, sometimes varying by type of employee. The employer tax exemption is the government's third largest healthcare expenditure after Medicare and Medicaid, reducing tax revenues by $260 billion per year. This slide shows the organization of the health system in the United States. It shows the breakdown of the public and the private financing that I just discussed. Now that we've reviewed the healthcare system for the United States, and we know that the United States spends $9,507 compared to France spending $4,530, what exactly does all of this money cover? Most insurance plans will cover a set preventative services at no cost to you. This includes shots and certain health screenings. If you buy a plan through a health insurance marketplace, your insurance will cover the preventative services. It will also cover at least 10 essential health benefits required by the Affordable Care Act. All private health insurance plans offer a federally facilitated marketplaces will offer the following 10 essential health benefits, also known as EHBS. Ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, and chronic disease management, and pediatric services. This next slide shows the healthcare system performance compared to spending. We already know that the United States is outspending all of the other countries. So looking at this slide, it shows higher healthcare spending. And is the higher healthcare spending mean that you are getting more of a higher performance, which is not necessarily true. Looking at this slide from the Commonwealth Fund, it shows that even France is in the lower part of this healthcare system performance compared to some of the other countries. This second slide is showing what was involved in the analysis of the performance scores. It was the overall, the care process, access, administrative efficiency, equity, and health outcomes. As you can see, France, Canada, France, and the United States are on the lower performing scale on this. This slide shows the salaries of general practitioners. Comparing the salaries of a general practitioner in France and the United States, they both pay their doctors very well. In France, specialists earn an average of $149,000 and general practitioners roughly $92,000 per year. While the United States, a specialist can expect to make $230,000 a year, while a general practitioner makes roughly $161,000 a year. Unfortunately, the U.S. is expected to have a significant shortage of doctors in the next 15 years due to higher practice costs and lower insurance reimbursement rates. Doctors in the U.S. also worry about being sued for malpractice, and the cost of malpractice insurance is skyrocketing. We'll now take a look at prescription drug spending. Retail prescription spending per capita in France is $553, and in the United States, it's $1,011. While prescription drug spending also rose in 2014 and 15 in several other countries, Germany, Norway, Switzerland, and the United Kingdom, the increases were not as large or as abrupt as in the United States. The result is that by 2015, the United States spending on pharmaceuticals exceeded $1,000 per person and was 30 to 190% higher than in the other 9 countries, which you can look at in Exhibit 2. We've reviewed the healthcare systems of France and the United States, and while France is ranked much higher than the United States, there are still some challenges. The biggest challenge for France is the cost. The funding for the healthcare system comes from the tax that the citizens pay, as they are obligated by the government. As the demand for healthcare increases, so does the taxes. This means that they would have to spend less on their necessities. Another issue is improving access to healthcare. For financial reasons, some citizens and residents currently do not seek needed treatment, particularly when it comes to dental and vision care. Others cannot find an independent healthcare provider that charges the rates reimbursed by national health insurance, let alone consult doctors who charge more, despite the fact that premiums have been capped since 2013. Others yet live in areas known as medical deserts where there are no local doctors. The biggest challenge for the United States are the disparities in accessibility and quality of health care. The divide between health comes from the rich and the poor in America is among the largest in the world. People in households making less than $22,500 a year, 38% report being in poor or fair health in a survey taken between 2011 and 2013. That's more than 3 times the rate of health troubles faced by individuals in households making more than $47,700 a year, where only 12% of people reported being in poor to fair health. The U.S. Surgeon General has the following recommendations to reduce these disparities. Number 1, ensure a strategic focus on communities at greatest risk. 2, reduce disparities in access to quality health care. 3, increase the capacity of the prevention workforce to identify and address disparities. 4, support research to identify effective strategies to eliminate health disparities. 5, standardize and collect data to better identify and address disparities. In conclusion, when comparing the healthcare systems in France versus the United States, we can see why France is considered one of the most efficient, functional healthcare systems in the world by many, including the World Health Organization. They use a combination of private and public coverage, and nearly everyone in France has health insurance. Most people in France have additional private insurance, and almost all medical bills in France are covered by the government. France has one of the top rankings when it comes to efficiency and spending on medical care, which also allows the government to pay around 70% of all medical bills. The United States has many challenges with health care, including that Americans pay way more for health care than any other country. Half of all healthcare spending only goes towards 5% of the population, and there are millions of Americans who still don't have medical insurance. But the U.S. is getting some things right. Wait times are much better in the U.S. Most hospitals in the U.S. have the latest technology, best trained people, and the pharmaceuticals are at the cutting edge as well. The United States leads the world with healthcare technology innovation. We just need the United States, our country, to focus on healthcare for all Americans, which I believe is a right. Thank you.